Health, medicine, and wellness. The three corners of a triangle called life. But when the triangle is broken, it's up to the professionals to help our citizens survive, giving you an open view of the medical world. This is Doctor's Diagnosis. This is Dr. Gabriel, a well-known general practitioner here at Huntsville's clinic. He has been working here for over 15 years and is well known for his flawless practices and unmatchable skill.
I strive to give my patients the best care I can give them whenever they have pain, nausea, whatever it is. I work for the patient. I strive to make the patient feel the very best that they can. I am Dr. Gabriel, and this is Doctor's Diagnosis. Hello, Edwin. How are you today?
Good to see you, doctor.
Where would Marco be today?
He's at a friend's birthday party. I didn't want to pry him away from that.
I understand. I have a teenage boy myself. Come, let's go to the office.
My name is Edwin Milne. I'm the father of Marco Milne. Marco has been showing some concerning signs ever since he was 12 of low testosterone levels, possible ADHD, abnormal muscle growth. He's 15, he still hasn't gone through puberty. I've been taking Marco to checkups here with Dr. Liam Gabriel every so often. Last one was 2016, just to see if he's okay. Hopefully today we can get an answer to all his problems. Just right here?
Yeah.
Thank you.
So, let's just go over some medical history. Is that okay with you?
Sounds good to me.
So, Edwin, you understand that during one of our recent checkups, he was having some abnormal body tissue in the chest area.
Mm-hmm.
And our last checkup, he had small testicles and a small penis and low sexual drive.
Mm-hmm.
And we also took his blood. His karyotype will come in.
What is a karyotype again, doctor?
A karyotype is a visual map of your chromosome structure, and with that we are able to see if your son has any genetic diseases. Your son's blood was sent to the cytogeneticist who created this map.
A genetic disorder? I thought you said he had ADHD. You prescribed him this drug, antimexitine hydrochloride, for ADHD.
Yes, ADHD is common and explains the impulsiveness, and the physical symptoms could be explained by him being a late bloomer. However, he came in to me last time with small testicles, no sexual drives, and I noticed he had small shoulders and quite a big waist. He's still 15 and hasn't gone through puberty. And also, you've noticed that he's had severe side effects to the medication, which concludes to me that there may be possible misdiagnosis. So I sent the blood just in case.
I have been very concerned about my son's health over the past couple of years. He has been on ADHD medication for a very, very long time, and his side effects have been very severe. We switched his medications, but that medication was less effective. If he does have a genetic disorder, I'd like to know how to treat it as soon as possible. So, what do you think this genetic disorder could be?
Well, with the symptoms that have been presented, I've narrowed it down to 2 genetic diseases, but I need the karyotype to be 100%. Sure. It will come today, though.
So do you want me to stay at the office, or?
You can leave. When I get the results, you can come back.
So you know my number and everything?
I have your number.
Thank you, doctor.
Have a good day. Marco's been a long patient of mine, and we've known each other for many years. And I believe it is important that I find out what's wrong with Marco so I can help him the best I can.
Although Dr. Gabriel has come close to solving Marco's problems, we'll have to wait until the genetics lab gets back to him in order to fully confirm his research.
Huh. Email. Karyotype for Marco. Let me take a look. No, this is worse than I imagined. I suspected this. Good morning, Karen. Edwin? Yep, the results are in. I found out what's wrong with your son.
Dr. Gabriel.
Edwin, I know what your son has. He has Klinefelter syndrome. Klinefelter syndrome is caused by non-disjunction. It is one of the mistakes in meiosis, the creation of gametes. First, you begin with after the egg and sperm fertilize, and you get pairs of chromosomes. The problem is, sometimes there are mistakes, and some chromosomes fail to separate from their homologous pairs, which gives either an extra chromosome or lack thereof. Klinefelter's is from the chromosome that determines your sex. Females have two X chromosomes. Males have an X and a Y. Unfortunately, Marco happened in non-destruction. Usually it happens in anaphase 1, but it is possible in anaphase 2. Marco, unfortunately, has inherited an extra X chromosome. Son, an extra X chromosome.
So usually males are supposed to have just an X and a Y, right?
Just an X and a Y, but because of what I told you, he has an extra X chromosome.
What does this mean for Marco?
Come back to my clinic and I'll tell you. Just wait, Edwin. Let's go.
Just be a second, Doc.
Come on.
Sorry, doctor, for the wait. So, what does this mean for my son again?
Well, with Klinefelter's, as he goes into adulthood, he will continue having breast growth. He'll be infertile. He'll have low testosterone, which is very important because with low testosterone, you'll have poor muscle and bone development, an increase in body fat, and decrease in energy levels. But there is hope. I can sign him up for testosterone replacement therapy.
Replacement therapy?
Yes. He will be injected with testosterone regularly, and with that, he'll be able to go through puberty like a normal person. I'll sign you up for a specialist. However, I'm not giving you pill form because that can harm the liver.
But he will be able to live a normal life, right? Like,
yes.
With the replacement therapy as well, will he also be able to live a full to the life expectancy?
Oh yes, he'll live a healthy life. However, his life expectancy may be decreased to 2 to 3 years, but not to worry. And he may not be able to have kids, but there are fertility researchers helping with this. So who knows? Maybe in the future, your son will be able to have kids.
So
here you go. Give this to the nurse, and we're good.
All right, Dr. Jaden. Thank you, Dr. Gabriel.
Call me Dr. Dom.
Dr. Dom, it's been a pleasure.
Next week on Doctor's Diagnosis.
Could all doctors please report to like 513? All doctors 513. This is a medical emergency. Doctor, what's wrong with me? Dr. Gabriel, I have some very terrible news.